Well, hello, everybody. This is Dr. Jamie, and I'm here with my friend and colleague, Caroline Redmon, who is also a licensed marriage and family therapist. And we just want to talk to you today a little bit about borderline personality disorder. And I plan on bringing this to you throughout the month, and we'll talk a little bit more next week and the following week, and so on. So let's go ahead and get started while Oakley gets herself ready there in her chair.
And
And
Jupiter's behind me.
uh-huh. Um, so welcome, Caroline. Thank you for joining me on this fine Sunday
It's good to
afternoon.
be here. Thank you.
All right. So let's get into it. So a little bit about borderline personality disorder. A lot of people can have characteristics of it, and not actually have the disorder. They just have some of the traits. But when a person has borderline personality disorder, it is a pervasive thing that just clouds their entire life, basically. And um, they tend to have major difficulties with relationships, and they idealize and devalue. They have a lot of boundary issues, right, Caroline? That's
Absolutely.
yeah.
Yes.
Identity disturbance. They they can have a very unstable self-image and sense of self and have wild mood swings and angry outbursts, chronic fears of abandonment. And we've both seen clients really frantically make efforts to avoid that, avoid abandonment, right?
Absolutely. And I think that that stems from early childhood,
Yeah,
either neglect or abandonment, and somehow their self-perception gets formulated, if there is such a word, of how they perceive themselves. If mom and dad reject me or are not there,
right.
they get this perception that they're not good enough, and causing them to, it colors their whole perspective. When you were mentioning about idealization,
Hmm.
maybe wanting people to be a certain way
Hmm.
and seeing them unrealistically.
Right. And a lot of times it's also the parents might have a personality disorder. And
Mhm.
oftentimes we see that the love that they show their child it's contingent on something. It has strings attached. And so, the child never really knows what to expect from their parent. And so you get that abandonment, that rejection, with the instability of what can I expect, right?
Exactly. Yeah.
Yeah.
And they feel very devalued, like they're not worth it.
Yeah.
And that can get into how, you were talking about how this unstable self-image. And if they have a negative self-image, they don't even allow themselves to feel good about anything.
Yeah.
And if they feel good about something, they feel like, well, I don't deserve this because I get this reflection back that I'm not any good.
Right.
And so self-sabotage can enter into this.
Yeah, yeah. And that's where we get all of the impulsive and irrational behaviors. And they may have substance use issues and self-injury or even suicidal behavior.
Absolutely.
And they
Uh,
and one of the main things is they really evidence chronic feelings of emptiness,
Oh,
right?
yes, yes. And that emptiness that you mentioned
Hmm.
affects them, that they look for external ways to feel good about themselves.
Exactly.
They look for affirmations from other people. And if they don't get that kind of quote unquote approval from mom or dad, they look for it in other people. And when other people don't perform in the way that they want or give them the feedback that they don't want,
Yeah,
then it reaffirms this: I'm no good,
yeah,
I'm less than.
yeah,
And it very painful,
yeah.
very painful.
Absolutely. Yeah, yeah. Yeah. And once they get in therapy, we find that they're unable to really think straight or to calm themselves in a healthy way. They can say very hurtful things, not only in with relationships that they're in at home or with friends or whatever, especially close relationships, but with a therapist as well. They can say very hurtful things and act out. Going back to that idea of the self-injury and the impulsive behaviors and stuff, they can act out in some very dangerous ways and very inappropriate. So it's
Absolutely. And sometimes too, when they come to therapy, when they're wanting help,
mhm,
they will look for, or they can focus, coming to therapy rather, wanting to focus on things that are external.
yeah,
If things in my life were fine, if I had a job, or
right,
if I looked a certain way, or what have you, if I can fix all this external stuff around me, I'm okay.
yeah, yeah,
And then the idea of, refocusing, I think that's part of our job, and you'll get into this as we go along, is to help them look inward, to
yes,
deal with what's going inside. And that is very hard for people who exhibit borderline personality traits.
yeah,
And usually they want to run away. It
right,
gets to be too much. I'd
much,
rather I'd rather focus on something
yeah,
that doesn't hurt as much, as
yeah,
opposed to looking inside and going, oh man, this really truly hurts. The
yeah.
pain gets overwhelming and they run away.
Yeah, well, and that's why they blame other people a lot of times as well. People who are close to them, so especially in spousal relationships or romantic relationships, but they will blame everybody else for every problem that's going on and really struggle to take responsibility for themselves and for their actions, their thoughts, their feelings, right?
Absolutely. It almost becomes victim mentality.
Yeah. Yes, it absolutely does. They it is victim mentality and they get into a lot of self-pity. And if you don't agree with that self-pity, make them feel good, then about being that way, then that's when they'll run out. Oftentimes
Mhm.
they'll just run out of the therapy room and slam the door behind them and just keep going because they
Absolutely.
just can't look at it.
Absolutely.
It's so painful. Yeah.
Yeah, it is. It's far too painful. They kind of like dance around the issue, so to speak.
Absolutely. And that's the thing, one of the things that I've heard from a lot of therapists over the years is that they don't want to share the diagnosis with their client. But
Mhm.
I completely disagree with that because the only way that someone can change and grow and heal from borderline personality disorder is if they want to change it. And they have to be willing to do a lot of hard, painful work. So they have to be aware of it. They have to be aware that they have it. Otherwise, they're not going to be able to change it. It is probably one of the, if not the most difficult disorders to heal from. So,
I agree. I completely agree.
yeah.
Um, I have worked in a hospital setting where there were schizophrenics
Mm,
and there were borderline people. And I found, believe it or not, easier to work with the schizophrenic
yes,
sufferers, so to speak,
me too.
than the borderline people.
Right, right. Yep.
It's hard. It's a
It's sad.
challenge.
It's a big challenge. Let me share my screen here for a minute so that we can look at uh the treatment components of borderline personality disorder. So, some people might think that you can take medication for borderline personality disorder, but you really can't. I mean, if you are taking medication, it's essentially for uh, depression or anxiety, which are things that run alongside borderline personality disorder. But as far as actually treating those characteristics of
Mhm.
borderline personality, the most common, I would say the most two common are cognitive behavioral therapy. And that's just looking at the negative thoughts, the automatic negative thoughts, the patterns and schemas that that we're kind of stuck with from childhood, and learning positive affirmations and cognitive restructuring. And then dialectical behavioral therapy is a big one. And it's used a lot in groups as well as with individuals. And it's basically a CBT, or cognitive behavioral approach also. I'm sorry, did you want to say something about that?
Oh, no, I was agreeing with what you were saying. I was going to say something earlier, but it slipped my mind, but it'll come back. Maybe it'll come back. Oh, yeah, I do remember. See, it did come back. Medication. I'd
Yeah.
like to just take a sidestep here with medication.
Mm.
I think the problem with medication is that people will take medication, particularly any kind of psychological medications, and they think it's going to fix them.
Right.
And these medications, I believe, are only for a temporary period to stabilize people so that they can open up and get ready to work. And I think a lot of people are given a disservice when they go, well, here, pop this pill, you're going to be fine.
Right, right. And that absolutely is not going to work with a personality disorder. It will not.
Agreed.
It takes a lot of hard work to heal from a personality disorder. Definitely. Yeah.
I
So
totally agree.
so the other treatments there kind of build on the first two. The dialectical behavior is teaching, skills training and mindfulness and distress tolerance, emotion regulation, and interpersonal effectiveness. So this actually was a treatment that was made for borderline personality disorder.
Hmm.
I mean, I really think that I would assume you would agree that the cognitive behavioral and the dialectical behavior they kind of run in conjunction with each other and are both used with anyone who has a personality disorder.
Absolutely. Absolutely. Because I think, as you said, that dialectical behavior therapy it's based on CBT.
Yeah, yeah, exactly. So, all right. So we just really wanted to give everybody a little taste of what we're going to be talking about this month, a little introduction to borderline personality disorder. And we really hope that you stick with us throughout the month. And we're going to be talking about things such as how it affects your relationships and how your loved ones might be able to help you through that healing, and the importance of sticking with talk therapy with a therapist in order to learn new skills and new ways of being. Anything else that you wanted to end with, Caroline? Or
I think you summed it up beautifully.
all right, great. Well, you take care, everyone out there, and we hope you enjoyed this little video, and hit us back later, and remember to like and subscribe to our channel, and we hope that you have a wonderful day.
And repeat the name of the channel just for confirmation.
The MindFlourish Network.
There you go.
All righty.
MindFlourish Network.
Yep. All right, you take care, everyone. Bye-bye.
Bye.